My name is John Archie Macmillan. I come from the Western Isles of Scotland. I work as a mental health officer, enabling people to deal with mental health problems. I have been working as a mental health officer for nearly 20 years, and I had worked previously as a social worker in prison for 9 years. And as part of the work there, I chose to undertake the training for mental health officer. It brought together so many aspects of my life that I hadn't considered before, and how mental health affects not just the people we consider to have mental illness, but all of us to some degree. I wasn't long working in the prison when I realised that mental health in the prison was a serious matter that was being overlooked, and I felt frustrated that the main reason for a lot of the crime that was being committed was not being addressed. And that is one of the things that encouraged me to become a mental health officer. I have always worked with principles in mind, and the main principle of all is that I work with the person, with the client, and try and keep the focus on that rather than on budgets or protocols or people's way of working. The most important person is always the client, and I enjoy that because at the end of the day, if you aren't helping the client, you are not doing your job. And I feel that establishing a relationship with clients is the most satisfying thing that I can do. I would encourage people to get involved because they not only discover ways of helping other people, but they can find ways of helping themselves. The main skill needed to do this job is an understanding of the person you're working with. Above all, develop a way of relating to other people, listening to them, hearing them, understanding them, and showing them that you actually care for them. This isn't easy, it's tiring, but it's also hugely important. If I were to give advice to someone, I would ask them to be careful to develop that in a positive and healthy way.
Human Forward. Randstad.